One of the biggest lies you have probably been told for a long time is that diabetic patients should never take sugar. That is a lie. Listen carefully. Most of the times we see patients come to the hospital that are diabetic and their carers utterly resist the nurses and the doctors from administering glucose to these patients. But what they don't understand is that diabetic patients come to the hospital most of the times because of hypoglycemia, that is low blood sugar, than they even come for hyperglycemia, which is high blood sugar. So tell me, if a diabetic patient comes to the hospital because the sugar is low, wouldn't you give that patient sugar for the blood sugar to rise? So they need glucose because glucose is sugar for that blood level to increase. If you have been told in the quarters or by any roadside vendor that sugar should never be given to a diabetic patient, it is a lie. It is a lie. Be cautioned. Sugar should be given if the patient has hypoglycemia. So if you are resisting the doctors from doing that, it means you want your patient to die or you want to lose your loved one. Allow the doctors, allow the nurses to do their work because they understand the disease and they know when to give glucose, they know when to give sugar, and they know when not to give it. Be cautioned. Thank you, and share this message with someone.